Hi, my name is Anika Majaria and you're watching Dubai Live TV. I am at the American Hospital with Dr. Donatella Casiglia, who is an endocrinologist here. Hi Doctor, thank you for being here.
Good evening, hi.
Tell me a little bit about yourself and talk to me about what an endocrinologist does.
I specialize in my home country. I'm Italian actually, but I had the fortune to move around, to have more experience. And so although I get my training in Italy, then I stay for a long time in UK, and then I move here. So it's good to move, though you learn more. I am an endocrinologist, and the endocrinologists look after endocrine gland. There are many glands in our body. These glands produce hormones. I'm sure that everybody knows about hormones, but actually what the hormones are important molecules which are produced by different glands. For example, thyroid is a gland who produces thyroid hormone. Pancreas is a gland who produces insulin mainly. These hormones are very important. We cannot really function without hormone or if we have too much hormone.
What abnormalities do you typically come across?
Most frequent disease of the endocrine system are those who affect the thyroid, and even diabetes is in a way an endocrine metabolic disease. So the majority of the patients are diabetic or have a thyroid disease or a pituitary disease. Pituitary gland is a gland that is deep in our brain, produce different hormone, and some patients might have a normality or produce too much hormone or produce too less hormone, and of course they need to do a workup and assessment.
Why do you think diabetes is such a big issue here in Dubai?
Diabetes is a big issue a little bit everywhere, honestly. However, we know that especially type 2 diabetes is increasing, mostly in developing countries. You know, in few words, we face that there are too much food around, people doesn't do enough exercise, they start to be overweight, and then this drives to the obesity, which is one of the leading reasons why people can develop diabetes.
And what is the difference between type 1 and type 2?
Yes, type 2 is the most frequent diabetes, which actually usually happen in old adult people. And it is due to two main reasons. One is that these people is genetically predisposed to get type 2 diabetes, so it's a very important genetic component for what they cannot produce a lot of insulin, but also insulin doesn't work very well. So they have this double defect. Type 1 diabetes is much more rare than type 2 diabetes, and is classically this kind of diabetes occur in childhood or adolescent, and these kids really need to start insulin straight away.
What treatments are available here at the American Hospital?
We have a vast range of treatment for both type 1 and type 2 diabetes. Type 1 diabetes, we offer extensive education about the use of insulin, and we also offer extensive education about the use of insulin pump and electronic device for the management of diabetes. For type 2 diabetes, we have all the majority of the available pharmaceutical treatment, which include both oral medication and injectable medication, not only insulin, but other more recent new medication. They are very effective in this kind of patient, which are called GLP-1 receptor agonist.
How does technology play a role in your field?
It definitely play a big role in a patient with type 1 diabetes, because as I told you, insulin pump is a device for what the patient, it doesn't need to inject insulin every day, but the insulin is delivered by this device, and this is a offer a very good way to manage type 1 diabetes and achievement of improved diabetes control, reduce risk of complication, and so on.
Great, thank you so much. That was so informative, Dr. Donatella. Thank you for being here.
You're welcome. I'm very pleased. Thank you.